Hey guys, welcome back to Define Joy. This is another Focus on the Diagnosis special episode about Dermatomyositis MDA5. So I'm going to be speaking obviously as a patient, not an expert, not any kind of medical background whatsoever. But dermato as in skin, myositis as in muscle, and the MDA5 from what I understand is a special immune cell that goes after a certain type of virus. So with a lot of autoimmune diseases, what that means is your immune system, which should be attacking enemies, has for whatever reason gotten confused and it's attacking healthy cells in your body. So with MDA5, this certain type of immune cell is turning against your body, attacking healthy cells. Why? I don't know. But yeah, that's what it seems to be. Now, MDA5 is a very elusive diagnosis. What happened with me is I showed very vague, autoimmune symptoms starting in 2023. At first they thought, it must be like lupus or something like that. But they decided pretty thoroughly now it is absolutely not lupus. They have said that I have a mixed connective tissue disease, so basically a overlap syndrome of many different types of autoimmune conditions. Some of them meet the entire diagnosis of those conditions, some are just traits of them, so to speak, but I do have all of the diagnostic criteria for dermatomyositis MDA5. So please let me know if you guys are affected by this disease. It is a very troubling diagnosis to receive. For one thing, it's super rare, but it seems to be very little understood about it. And let me know if you're in the midst of trying to be diagnosed with something. It took me 4 opinions of doctors to finally get to someone that knew what it was. But yeah, doctors kept scratching their heads about it. What led to my diagnosis is basically I was having muscle problems, and several doctors were like, oh, you have lupus. Oh, another one's like, no, you don't have lupus. I don't know what you have. It's just something weird. And I was like, something's wrong with my muscles. Like, please check my muscles. And one doctor was checking my muscles, and she's like, you have muscle tone, you have strength, you don't have myositis, you don't have a disease of the muscles. And usually that's true with myositis, which myositis in and of itself is very rare. But usually you have extreme muscle weakness in any type of myositis. But that's what makes dermatomyositis MDA5 pretty unique, is that you can still have muscle strength and tone. But what makes MDA5 also unique, what is very scary, is its attack on its favorite organ, which is the lungs. But anyway, I begged at this doctor. I was like, please, like, run a myositis phenotype check on me. Just please give me that peace of mind. And she was looking at me like I'm a total hypochondriac, which is funny because my mom's a nurse, and my mom basically had to drag me to a doctor at any time for just like an annual checkup as a kid. So I'm the polar opposite of wanting to be around doctors, but when I know something's wrong by my instincts, I was like, I know this is something wrong. So I begged her to do it. She ran it. Guess what? Everything was negative except dermatomyositis MDA5. Well, she looked at me and she's like, Jasmine, I'll be honest with you, I thought this was going to be all negative. And she's like, I have never had a patient with MDA5 come back on here. Like, I don't even know if this means you have it. Well, basically, her lack of confidence was very alarming to me, and I ran to get my 4th opinion. And thankfully, I did find a doctor that was well versed in MDA5, and she is looking at me like, of course you have it if this is positive. And, it explained a lot of what I was having too, because I was having lung issues, and I've been a long distance runner for the better part of my life. I could run like a half marathon and do it again the next week, like no problem. I've never been a smoker. I've never had any kind of lung issues, never done illegal drugs, nothing like that. But all of a sudden I went from like being a long distance runner to I couldn't go 10 feet without needing like a 5 to 10 minute break every 10 feet. Like, I kid you not. It was ridiculous and scary. And I was getting to the point where I couldn't sleep unless I was completely in a sitting position, because the slightest angle back, it felt like my lungs could not inflate, like I couldn't breathe. And that's a very alarming situation to be in. Well, yes, apparently it was MDA5 doing all that. The biggest risk with MDA5, the most threatening, life-threatening thing with it is called interstitial lung disease. And the most scary one of those is rapid progression interstitial lung disease. That can be fatal within 3 to 6 months of the onset of that. So they're very obsessed, the doctors are, of checking to make sure there's no signs of that. What I've seen, it seems like best case care for MDA5 patients is every 6 months run a pulmonary function test, especially early in the diagnosis. and make sure that lung efficiency is still there and normal, and also a high resolution CT scan every 6 months to check is there anything abnormal inside the lungs or any signs of interstitial lung disease. Because even if you don't have that rapid progression, even over years of having MDA5, you could develop interstitial lung disease over time. So they are very obsessed with checking that. And then the care plan for it, there is no known cure for MDA5, but you just manage the crazy immune system with immunosuppressants. So they tried several attempts on me with high-powered steroids. Something interesting about MDA5 is it usually has no response to that. That happened to me, no response to high-dose steroids. They tried methotrexate and Plaquenil. Apparently I'm severely allergic to both. Let me know if that happened to you, anybody. But yeah, that was terrible. But I am very thankful for a medication called Cellcept. And, originally I was put on 1,000 milligrams. I've been bumped up to 2,000. I think max dose is 3,000. But so far it's holding. Cellcept is usually a major organ transplant medication, so the body doesn't reject that new organ from another donor. So it's like a heart, lung, kidney, liver transplant, but an off-label use is for autoimmune disease control. So basically, our own bodies don't, reject ourselves, basically. But it's a very dangerous drug, so make sure, no one in your family except the patient is touching that. Make sure wearing gloves and stuff. It's a very serious medication because it can affect the immune system. And if you have a healthy immune system, that can be very harmful. But if you have a crazy one, like me, maybe like you, if you're a patient, it can be very helpful. Another great use for Cellcept that a lot of patients report, and myself included, is its help on the lung function. So this doesn't happen with all immunosuppressants, but what I found is that I had several lung nodules. When I say several, like many, in March of 2025. Out of nowhere, those appeared, and I could feel the tension in my lungs, like the inability and the rigidness of it. And I think it was like 8 months later, they were completely gone when they checked with a CT scan again. And the only credit I can give to that is Cellcept. I think that medication did that for me. It made it much easier to breathe. But also, I need support with a combination inhaler. I've been on Brio Ellipta, which is very useful for me. And for insurance reasons, I switched to Dulera to make them help me out a little bit more there. And that's also been very effective. So that's usually a COPD medicine. And that's usually what people think of as like a smoker's disease. Once again, never been a smoker, but you can develop COPD or COPD-like issues with autoimmune disease. So that's been helpful. Something else I benefited from is in, a severe weather system starts to come in. It could be like 36 hours beforehand. I could feel it. It's like, let me know if you feel this too. It feels like an elephant is like stepping on your chest and won't let up. And then when it rains, all of a sudden the elephant picks its foot up. So I've learned when I start feel those barometric pressure problems, I'll take a albuterol rescue inhaler, and that helps me get through that storm without having a breathing emergency. I've also benefited from an oxygen concentrator, and that's like 2 liters of oxygen. So, sometimes my family notice like I'm acting kind of confused. I usually, think pretty fast and can convey my thoughts rather quickly, but if I am having low oxygen, I'll get a dazed, glazed look and just kind of get real tired and sluggish and weird. That's the best way I could put it. Almost like I'm intoxicated or something, but it's low oxygen in the brain. But I'll use an oxygen concentrator, and that'll help. Also, if I'm high altitude, like an airplane or at a higher elevation, I'll bring that oxygen concentrator too, and that has helped enormously. So let me know if you benefit from any of those therapies. But yeah, the biggest thing with MDA5 is that risk on the lungs. And from what I understand from my doctors, it looks like there's 3 clusters or tiers of MDA5. Cluster 1 is the one where you usually see that rapid progression interstitial lung disease, that ILD. Cluster 2, I guess, is most often women, and usually that's high joint and muscle pain, but not usually more severe symptoms beyond that. They originally thought I was that when I was first being diagnosed. They've now upgraded my severity to cluster 3. And cluster 3 is more systemic problems of circulation. And I've had Raynaud's phenomenon, if you want to look up that, but I could do another episode on Raynaud's later. That's a whole issue and a whole kettle of fish of its own. Small vessel disease, like my toes and fingertips have sharp pains because the blood vessels over there are just basically not getting blood anymore. and dysautonomia. So basically the autonomic nervous system is malfunctioning for some reason. And they've found that is secondary POTS, postural orthostatic hypotension. So I had this dysautonomia secondary to autoimmune disease. So the autoimmune disease, for some reason, it seems unknown, has caused damage to my autonomic nervous system. So to deal with that, yes, this came from my cardiologist. He wants me to be on high amounts of sodium per day, like 7,000 to 10,000 milligrams per day. Some people with dysautonomia have to watch their sodium, but that's kind of more rare. But so yeah, make sure you talk to your cardiologist first if you have dysautonomia. But my cardiologist told me high sodium and high protein, and that's like the most unexpected thing I would think for a cardiologist. Like, be prescribed like chips and French fries and beef. I'll take it, no complaints. But yeah, I have to wear compression stockings and compression tights all the way up to like my mid chest to make sure that blood flow, if I'm standing, keeps going up to my heart and my brain, because my heart freaks out. Otherwise, I'm used to being, like an elite athlete. I could tell my heart rate, what it was doing at all times. I was used to a resting heart rate of like mid-50s. And when I first started having dysautonomia symptoms, I would have a heart rate that was like sitting down like 125 out of nowhere, not doing anything, just randomly. Stand up, it'd be like, shooting up onto 135 beats per minute, just out of nowhere. But yeah, you feel like that, you get dizzy, you can faint, all kinds of stuff. And yes, if your blood pressure goes low enough, it's a life-threatening emergency, and I've gone to the ER for that before. But yeah, so that's kind of the systemic circulation issues that I've seen from it. So yeah, if you are in any of those different kind of tier categories, if you've identified or you think you might be one, please comment that below. But back to the main thread of MDA5, the lungs. I just want to encourage you guys about breath, because for me, that has been the most stressful thing physically. If you've ever had the feeling that you can't breathe, it is a very instinctual and real, terrifying experience. But to again encourage you guys, there's a verse in Job 33:4. It says, "The Spirit of God has made me. The breath of the Almighty gives me life." I just want you guys to reflect on that, because I know what it feels like when it feels like your own breath is failing you. It is a very real feeling. So just refocus and pray to Yahweh and remember His promise. And He says, "The breath of the Almighty gives me life." Rely on His breath in that moment. And I found, I go to church and they have the worship songs or like praying out loud. Speaking for a long period of time or doing worship, it can make me very out of breath, start having a coughing fit. You can still worship with your mouth closed. You can still worship without saying anything. So don't forget that. Same thing with praying. The Holy Spirit will speak for you. Don't feel like you have to have the words or the breath to say. Rely on Yahweh's breath. And I'll pray for us. Yahweh, just pray for any of those that are affected by MDA5, whether they be patients, friends, family of this disturbing and scary disease, Father. I just pray that if they're in the midst of a diagnosis, that you would help them have doctors that are wise and knowledgeable to identify what this is, or if the doctor has never seen it before, they would have the humility to say so that patient could get another opinion and figure out what's going on. I pray that you would fit them well with a care plan of whether that's immunosuppression or breathing support that they need. And Father, just please help us to remember that it is you that gives us life, and we just rely on you, and we just thank you so much for your breath in us, Father, especially when we don't have breath ourselves. In your name, Jesus, amen. Oh, and I just want to tell you guys, meet Tikva. This is my service dog prospect. She is every bit the 9-week-old puppy right now. So I'll do some other videos about her. But yes, if you want to follow me more and see more current and probably, if not daily, video updates and postings about Tikva and her training, that's her name, Tikva. Yes, you can follow me, Jasmine Barker, on Facebook. I try to do my best to post a lot about her, but yes, I'll be training her to take over eventually for my current service dog, Chase. So Chase is going to be a senior this fall, and it takes at least 2 years for a puppy to go from ground zero, knowing nothing, to a full task trained service dog. So I'll try to let you guys join in on that journey and that process, because it's a lot of fun. And yeah, who doesn't love a puppy? Alright guys, keep that joy defiant, and I'll see you next time.